Welcome to the show, John and Autumn Zarowski.
Hi.
Hello.
Glad to have you joining us. Your physician, Dr. Jack Forbush, was kind enough to introduce us, and he has been a guest on the show. In fact, he's this week's episode, talking about, from his perspective, why he went to direct primary care. And I am very curious about, what was your care like in the old system? What was it like for you two?
We always liked our providers. We always had excellent care from our providers, but it was very difficult to actually see our actual provider unless it was the yearly physical that was scheduled 365 days ago. If we needed a sick appointment or something like that, we never knew who we were going to get, and you didn't have that relationship. So if I felt that I needed an antibiotic because I had some kind of bacterial infection, they would say, well, let's wait another 2 weeks and then come back. Whereas my regular doctor would be like, oh, this is John. He knows what he's talking about. If he says he needs an antibiotic, I can give him one. He's not going to abuse it.
Important point.
And the other, hard part is like he had said, is not seeing your provider. And then a lot of times the practices have turnover, so your provider leaves. And then you don't have that consistency and that relationship that you have with someone who's with direct primary care.
How much was a time sink? I mean, you live in Central Maine, so
yeah.
What was the time sink like getting your care?
So it's very rural where we live, probably more cows than people in our town. So it was at least a 40 to 45 minute drive just to get to the doctor's office, which is fine. I mean, that's the price you pay for living in the country. But then we would get there and, you want to arrive early for your appointment so that you're on time. And then you would sit in the office for 15 or 20 minutes. And then they would call you back to a room. And the providers inevitably were double booked, sometimes triple booked. And you would sit on the exam bed table thing there for another 20 minutes. And an hour would go by from your scheduled appointment time before you actually got to see the doctor. And when the doctor came in, they would spend about 10 or 15 minutes on their computer asking the same questions that the nurse had asked you and typing. And sometimes it felt like maybe you had 10 minutes of actual FaceTime with the doctor discussing what your issue was and trying to find a solution.
And they make it one issue. You can't go in with 3 problems.
Right.
You have to have 3 different appointments because they're slotted for 15-minute appointments for one issue.
Right.
Goodness. Yeah, that's pretty typical in many of the old school practices, the old obsolete system, as I'm fond of saying it, because it really is obsolete, as you well know now.
Yeah.
From a cultural perspective, meaning things like books, TV shows, movies, what were your cultural influences for care?
I don't know that we really have a lot. I mean, we don't watch a lot of TV to begin with, and
And I'm an ER nurse, so
we both volunteered as emergency medical technicians and a paramedic, and so we weren't real starry-eyed about what we should be getting. And if we watched something like Grey's Anatomy, our favorite thing to do was sit there and say, yeah, that's fake. That wouldn't happen. No, that doesn't work. So we get it. And we understand how, the pressure that healthcare providers are under and all the different directions that they're pulled in. It just never seemed like this was working. It always was getting worse. Every year our insurance was getting worse. It was costing more and covering less. And it got to the point where I didn't even want to bring our kids into their pediatrician's office. We've got one son, Quinn, who has a reactive airway disease or something that he's going to grow out with. It's some kind of catch-all term. But every time he gets a cold in the winter, he gets this coffee seal-like bark, and it just doesn't go away. I mean, no matter what we do. And so we have a routine that we go through. First, we try the home remedies, a hot shower, lots of steam, over a bowl of Vicks, something like that. And then we move on to a what is it, albuterol?
Yeah,
A
nebulizer.
nebulizer that, we got way back when, I don't know where. And that inevitably calms it down a little bit, but doesn't clear it up. And ultimately he ends up needing, prednisone. And maybe a week of prednisone, and it clears right up.
Yeah.
And I hated to go into the doctor's office because you wait, like we were just saying, and then the secretary finally gives you the form with all the little check boxes on it. And I never knew. I'm like, okay, I'm walking into this place and it's going to be a $40 copay plus another $40 co-insurance. And then depending on which provider I get and what boxes they check, it's going to be hundreds of dollars when I walk out. And I may not get the prednisone that I know he needs and his regular provider knows that he needs. It just would blow my mind.
Right, because you would see the urgent care person that's at the office, not your provider.
Or who was ever assigned to sick call that day, or sometimes they wouldn't be open and then you'd go to urgent call, and that was $400 to walk into,
Right.
only slightly cheaper than just going to the ER.
Right. And being an ER nurse, they have to be sick, real sick before I either go to the doctor or the ER,
And that's not it. I mean, as terrible as he would sound when he comes in with that cough, he's walking, talking, breathing. I mean, he doesn't belong in the ER.
Right.
That is not an ER illness. It's something that his regular provider should be able to take care of. So it was just always riddled with anxiety when you walk in there. How much is this going to cost us? Am I actually going to get the care that he needs?
And then if it was when those hours of the urgent walk-in care wasn't open, they just tell you to go to the ER. And being on the receiving end of that as a nurse, and everyone, they know they want to go to their doctor, but their doctor doesn't have an appointment for 2 or 3 weeks. So they send them to the emergency room.
Right.
And as independent insurance holders, that's a costly visit for a doctor's appointment. So
you're sending people, the old system sends people into the most expensive part of the healthcare system aside from the ICU for massive rehabilitation, kind of care, like after learning how to walk and talk after a stroke.
Right.
For minor things.
Yeah.
Houston,
It
this is more than a problem. This is a catastrophe.
is.
And
it is. It
And
really
you have an insider view too, which makes this even more poignant. You see it, and it's first of all, there's a FUD factor, if I'm not mistaken. There's a little fear, uncertainty, and doubt about walking out the door and will I even get what I know he needs based on multiple visits before.
Right.
You don't have the continuity of care. And that's got to weigh on you both as for your own care, plus of course as parents.
Right.
And these are some of the things that I try and point out. That there are things that people don't know, they don't know. The unknown unknown.
Right.
They may have the fear, uncertainty, and doubt, but they may consider that just normal because they know of no other way.
Mm-hmm.
And that's the purpose of doing these patient interviews. What surprised you the most about direct primary care?
For me, it was the length of time of the appointment. And I was able to go through all my concerns, all my questions, and have them not only answered, but there's education involved, there's teaching involved, there's
developing plans to deal with them.
Right. And goals and things to, work towards. And it's a holistic approach to not just be like, oh, here, throw a medicine at you. What are other things you can do? One of our sons, we were concerned initially about his weight, and Dr. Forbush took the time to talk to him and educate him and bring him to an understanding of it's about your ability to do the things you want to do, not what the number on the scale says. And because he's a pre-adolescent, I didn't want him to start worrying and stressing about his weight at age 10. or
Yeah.
11,
Wow.
you know, and he was. And I didn't, having gone through that my whole life, I didn't want that to go through with him. And he's, you know, he's in the parameters in that in the right percentiles and all that, but his body image he was concerned about.
And just having a provider that will sit there and take the time and have a serious discussion with an 11-year-old, it's amazing.
Yeah.
You know?
Not
Most
just
doctors
eat more
don't do that.
vegetables, you know.
Most doctors aren't going to do that, especially when they're already triple booked and are giving you 5 minutes of their 15-minute appointment that you were supposed to have. You know,
Yeah.
they just don't have time.
Which is pretty reassuring for you too.
Right.
It is.
Right.
It is. Absolutely.
So getting great care, which is what you have now, and you've already described the access, the continuity of care, the ability for your physician to listen
Yeah.
and
Yes.
and
I think
process.
Our first appointments with him were almost like an hour each.
Yeah.
And never did he look at his watch and say, well, I got to go. I don't even think he wears a watch.
I don't know. No.
He wears flip-flops, but no watch. You know,
I don't know
I
if you,
think the other thing that's really cool is he is an early adapter of technology.
Yeah.
You know, COVID hit here and doctors and people started talking about telemedicine. And I'm like, yeah, we've already got that.
Yeah.
You know,
yeah.
I'm waiting to see what else he decides to try. It's
Right.
awesome.
How does the lowering of the stress levels work for you? I mean, you've got to feel a lot more.
Absolutely. And it saves time and it saves worry because he has
Yeah.
the Spruce app that we can log into 24/7. Whether he's doing a mission in Haiti, he's accessible. I mean, he really is. I mean, he may not get to you in the next 5 minutes, but in that day you hear back from him and it's amazing.
The fact that you have the access to care, the fact that you have continuity of care, and that Dr. Forbush has time to listen.
I would say it's much less stressful overall. Like I said earlier, I used to go into a little minor panic every time I would bring one of the kids to our old provider because I never knew what the cost was actually going to be, even with insurance. And at the time, I think we were using the best insurance we could get from your employer.
Right.
And it was still a nightmare. I mean, we never knew what was going to be covered. We never knew how close we were to our deductible. With Dr. Forbush, it's $30 plus our yearly membership. You know, if I walk into his office, it's $30. And honestly, we haven't talked about this, but most of the time I don't even have to go to his office. You know, if the boys are playing in the woods and one of them comes home with a tick, I pluck the tick off and I take a picture and I say, do you need to see him? And he looks at it from the picture and says, nope, you're good. Or
That's
he'll
a definite
say,
bullseye. You need some doxycycline. Where do you want it sent to?
Yeah,
You know,
and we don't even need to go in for a traditional appointment for him to look at that bug bite, that tick bite. He'll just, you know, he can see it, and technology is amazing, and it saves us a ton of time and a ton of money. I mean, he's just as far as the old provider was, but I'm not spending an hour and a half driving to go see him. It's a quick message on the phone.
Yeah.
So it's a time saver. It's so much less stressful because I always know that the cost is going to be $30 or less. And you know, half the time, if he's got the medicines in stock through his office, because he'll sometimes sell prescriptions right through his office, that's a huge savings as well for us. I mean, we may still have to go up and pick it up, but
huge savings.
I don't know. It might be more quick to go to his office in Hamden than it is to stand in the line at the Walmart pharmacy.
Right.
And it's almost always cheaper when we can buy it through him.
Yeah.
So,
And he has, you know, the ability I can send him a message and say, it's the winter. We've done X, Y, and Z with our son Quinn's breathing. It's not improved. It's been this many days. Do you think it's time for prednisone? And he's this much weight and this, you know, and he boop, 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 and it's done. And it doesn't require dragging a sick kid out.
Yeah.
Yes.
You know, if he needs to do a Skype type thing or Zoom or whatever, he can and validate yes or no.
But because we have that relationship with him, we've been going to him for
3 or 4 years.
3 or 4 years now. So he knows. He's seen Quinn multiple times. He's seen this in person. He knows us well enough to know that we're not like, I don't know, fishing around for antibiotics or something like that.
Right.
We're not bringing that to him unless it's serious and we've already tried everything. And because he trusts us, he'll, do a quick Skype phone call or, ask for some more information via his Spruce app. And once he's got that, we're on our way.
What do
I wish everybody had it.
Right. It does. It's reassuring and it saves you time, saves gas money, travel time, all that.
Once you have it, you never want to go back.
No. I wish that there was options for a hospital that would do kind of the same thing, like an a la carte,
Here's your price list.
Here's your price list, and this is what it's going to be, and between my co-pays, my deductible, and my co-insurance I need to pay for anything that I use my primary health care for, it's outrageous. I wish his office offered X-ray and CT and MRI. Like, I wish he had all of that right there, just because.
Got 2 11-year-old boys that are going to constantly be pushing the limits, and most of what they're going to need is the occasional X-ray.
And a splint and whatever, so.
As hard as we can to make sure they're not jumping off their bikes.
I've been there.
Yeah.
So, first of all, I was going to suggest that you might have a look at what Desoto Memorial Hospital is doing down in Arcadia, Florida.
Mm-hmm.
They actually have direct primary care for their employees.
Oh, that's
awesome.
awesome.
It saved them $1.2 million the first year.
I'm sure.
I'll bet.
I'm sure.
And the hospital CEO is willing to talk to anyone. So you might want to talk to your HR department and say, by the way,
there's another option out there.
Yeah.
Would you like to save $1 million?
Yeah. Would you like to say? And that's a 40 or between 40 and 60 bed hospital.
Wow.
It's not very big.
No.
But it's a huge deal when you look at what kind of care they're getting. And their care is their primary care, their DPC care is being provided by Dr. Lee Gross. And
I knew that there were surgery centers around that were operating on the model and, doing hip replacements and knee replacements. And I remember talking to somebody who was like, yay, I just got my hip replacement done. It only cost me $15,000. I'm like, oh, if you were at this place in Oklahoma, it would have cost you 10. And what did they actually bill your insurance on top of the 15 you paid?
Right.
Right. I mean,
right.
It's nuts. Amazing. I didn't think that we would save as much as we do. I can't remember exactly what we pay for our yearly membership with his practice, but we were talking about it yesterday before we, started speaking with you, and just the normal maintenance over-the-counter medications that we take.
Prescriptions.
I mean, for me, it's lisinopril and allopurinol, which are prescription medicines, and they're both on Walmart's, low price, whatever list. It's still less expensive to get them through Jack and through his office. And not only can I get them through him, I can get them for 6 months at a time. So it's one trip every 6 months, as opposed to fighting with the insurance company every month for a 30-day supply. And I take omeprazole, which is over-the-counter reflux medication. It's Prilosec. And to buy Prilosec in the grocery store is $20 for 15 tablets or something like that. Yeah. It's cheaper to buy over-the-counter medication through him. And if we just add up all of that, plus the time saved, plus the time that we don't have to go in for an actual appointment because he can look at a picture over the phone of a hive or a bug bite or a cut and see if it needs stitches or not. Yeah. I mean, it saves us time, it saves us money, it saves us heartache, worry, stress. It's amazing. I mean, he's an amazing doctor, and it's an amazing practice.
Yeah.
He is quite the doctor. I've enjoyed my conversation with him. It was terrific.
Yeah.
And what are you saying to friends, coworkers, family, what's the hang up with their understanding? What's that conversation
I
like?
think it's the membership fee that they are concerned about because they're already paying for health insurance.
Yeah.
They don't realize it's a savings.
Yeah, I think there's this real mental disconnect between what health insurance probably should cover versus what it actually is today. I don't think most people understand the hidden costs because how would you? You can't get those costs when you call up a doctor's office or a hospital and say, hey, how much is it going to come to have my son's broken arm checked out? Should I go to the ER? Should I go to my regular doctor? Should I go to the urgent care? Like nobody's going to give you a price, so you can't compare. And it was difficult for us when we first signed up to make that decision. You know, we were so frustrated with our regular healthcare that we wanted to give anything else a try. Like we were just at our wits' end. And it took us a full year before we really realized what the savings was like. Unfortunately, not to get political, I come from a pretty liberal background, and most of the folks that I know are pretty big advocates for single payer healthcare, and I used to be as well. And seeing what I see and what I've experienced with Dr. Jack, I just think it's the wrong way to go.
Yeah.
Single payer doesn't mean we're paying less. It just means we're not able to see what we're actually paying on a bigger scale.
There's something that I wanted to mention, and that is patient privacy. Patient privacy is something, if for longtime viewers, they know I'm really concerned about, as are doctors. The Hippocratic Oath isn't just first do no harm, it's also zip your lips when it comes to patients, you know. So how concerned are you about that? Being insiders, you know better than the rest, but what would you say to the people who are looking at this and saying, okay, well, DPC sounds good, but it feels good, you save money, now what about patient privacy?
I think it's stricter through his office because he's the only provider there. I think it's anything I've had done elsewhere has been forwarded to him. He's received the results. There's no block in that communication. So he's able to receive it. It's sometimes a little challenging when they say, who's your doctor? When you're going to, like if I go to my place of employment, that's a hospital, who's your primary? And I'm not one of the people that is in their system. It takes a little bit for them to find him in the registry of whatever, but he gets all the results. He gets everything done and all the results sent to him. And I don't feel that there's an issue having any privacy issues with him. I mean, I feel he's more trustworthy to share everything with because it's not going to go anywhere.
Right.
Yeah.
I feel more trustworthy with him because he's kind of where the buck stops. You know, if we were still going to a larger practice, is it my doctor that's making the decision about releasing my information, you know, regardless of what I've signed, or is it some upper managerial person who I've never met? You know, we're firearms owners and we pay attention to red flag laws and stuff like that. And I think one of the things that concerns me is, will my medical information ever be released to other government agencies who then prevent me from purchasing another firearm or doing something else? Who knows? I mean, is that going to...
I mean, that was a screening question for the pediatrician's office beforehand. Like, do you have firearms in your home?
Well, yeah, we live in Central Maine. And just about everyone here hunts, and for some families, it's a large part of
that feeds their freezer
over there.
right.
I don't think that he would give out that kind of information without me giving him the okay, or
He's
at
not
least
required to.
Right.
Putting up a fight and saying, hey, John, just so you know, the Social Security Administration wants to know,
Right.
and they've contacted me. Oh, really? Whereas I don't think I would ever get that information from, one of our old providers or, hospital staff or anything like that. I
Yeah.
guess it's not bad now, but I could see it getting bad.
Well, they're doing social. A lot of people don't know it, but what you just described, the firearms, comes under social determinants of health,
Right.
which they're collecting through government required EHRs, which is probably the bane of your existence in the ER. Educated guess. No, I know that. But that's part of what they're doing. And if you are, of course, if you're on Medicare or Medicaid, the government has access without patient authorization.
Right.
So it's in the Federal Register as of December 2016.
Yeah.
So they can come in and do whatever they want.
Right.
Right.
And that's, again, when you go back to, the single payer, I would put it bluntly.
There's a lot of strings that come with that. And just like something like the Patriot Act, we're not going to find them all until someone gets jammed up
Yes,
and makes the news.
It's important to understand that when you have government spending taxpayer money, ideally there's an audit trail.
Right.
The GAO isn't going to say, oh yeah, let's, go spend 2-3 trillion, no problem. What? I mean,
Right.
Taxpayers would say, excuse me, no. So that audit trail means that you're going to have, someone, literally it means a registered nurse going in and looking at the primary care doctor's EHR.
Right.
Yeah.
To see if the reason for the visit matches the diagnosis and the treatment plan.
Right.
Right.
And most medical data theft is an inside job, just connecting some dots for the audience.
Yeah. It's just, I used to be a smoker. What if I had gone to the doctor and gotten, Wellbutrin to help me quit? And then suddenly someone sees, hey, he was on Wellbutrin. He must have been depressed. He should not be allowed to buy a firearm anymore. Well, no. And how do I even begin to fight against that and get that corrected? I don't know. I just think overall that if more people had the chance to try DPC as their form of primary health care, and if people understood the difference between health insurance and primary health care, I think it would be wildly popular. I think so many people consider health insurance as the catch-all, be-all. This is supposed to take care of everything. And it was never really intended or designed to work that way. Autumn and I still carry insurance through her work, but we now have the cheapest plan because it's the closest that we can get to a catastrophic plan. I wish that was available for us to buy, because going through Jack's practice and paying our membership, that takes care of 95% of our healthcare needs every year. And it's just less expensive. We still have to carry regular insurance in case we ever get hit by a bus or get cancer or something like that. But I think that kind of insurance would be so much cheaper if more people understood the difference between primary care and insurance getting you to believe that they're going to pay for everything, but they're really not.
You actually hit on something, knowing what you know now, if DPC became the standard of US healthcare, what do you think would happen to the national mindset?
It's hard to predict, but
Yeah. I think the difficult thing would be, where would the Medicare, Medicaid fall if the private sector was changed to DPC? Because there's still still a large portion of patients that are on Medicare and Medicaid, government supplemented healthcare.
and I think we still need some kind of a safety net.
Sure, but there's a large number of children and people that are on that and elderly that are on that for their health insurance that's provided for them versus then the rest of the people doing direct primary care. I mean, I would just be concerned about how they would mingle together.
Well, you have the good thing, I think, is when people understand the average, giving some metrics, you just said something about 90% of your care is handled by Jack.
Sure.
Yeah.
The average cost for DPC is $77 a month nationwide.
Right.
So it's $924 a year, and it's roughly $304 billion for
Right.
80 to 90% of the majority of care.
Right.
There's nothing that prevents government from giving a little prepaid Visa card that's fed every month for, you know.
Yeah.
I mean,
Yeah.
think of the cost savings there.
It'd be huge.
Yeah.
It'd be huge. I mean, if I had what I pay in health insurance biweekly in my paycheck, and if I had my deductible amount not to have to pay and my co-insurance amount to not have to pay,
No.
it would just, I mean, that'd be amazing. Amazing. It'd be a huge raise for me.
And
You know,
getting better care.
and
Yeah.
getting better care.
Well, this just popped into my head too. I mean, what if DPC was made so widespread? I have a lot of friends who are veterans and they are constantly battling the VA. What if VA healthcare turned into, here's your debit card, or this is what we'll cover. Go to your direct primary care. I mean, here in Maine, there's guys that are up in Caribou, which is almost Canada, that have to drive down to Augusta to get an appointment and go through the VA nightmare of trying to get their stuff taken care of. And that's a 5-6 hour trip.
Oh, ridiculous. Yeah.
Wow.
And it's ridiculous. I mean,
'Cause
these
the
are
clinics-
the people that we really should be taking care
Yeah,
of
the
more than
VA
anybody
clinics
else.
are closing left and right. They just don't have the funding and support to.
It could be a huge boon for people,
It's about-
populations like that.
If memory serves, it's about 10 or 11 million veterans under care right now. It's a total of 22 million veterans. And you're talking about 20 to $25 billion. Billion, not
Right.
trillion, but billion.
Yeah.
To have Jack level of care for the people that, I mean, these are some talking points that I think are worthy of discussion for people
Yeah.
down the road.
Especially I talked about how much less stress it was for me having Jack, to bring the kids in, to bring myself in.
Yeah.
And then I listened to, friends and their horror stories of being stuck at the front desk of the VA and having their appointment canceled and not being told until they've driven there, or being told they need another appointment for this particular,
And
imagine if they had.
Right. And they have high provider turnover there too.
They do.
Really,
They
I
do.
mean, they have no consistency of care.
Yeah.
So,
Huge issue right there,
yeah.
especially with veterans and monitoring, with combat veterans, especially mental health issues, just
Sure.
transitioning and that. It's one of the things that I'd point out, the fact that Jack has this relationship with your kids.
Yeah.
And he knows your kids.
He does.
He
Yep.
really knows them. So they're coming into the age, mental illness starts manifesting about 12, 13 years old.
Mhm.
And generally between 12, 13 and 25 is when it hits.
Yeah.
And, comes to generally. So if you have a doctor who has a great relationship, time to sit down with them, so they come in and they, normally they're asking questions and, I want to be a veterinarian.
Right.
Now they come in and they're like,
Yeah.
a bump on a log.
Right.
Jack's going to go,
Right.
what?
Right. He'll pick
Right.
up on the changes.
Guys, I think we need to talk.
Right.
Yeah.
I think that's something that's worth pointing out, is that primary care, most people don't realize. It's easy to pick up on mental health issues
Yeah.
for any patient.
Yep.
Right.
if they have the time and the relationship and the continuity of care.
Yep. And that's a huge difference. Primary care for us means we get our primary care from one guy. Primary care for everybody in the old system means you've designated one person as your doctor on an insurance form, but we don't know who you're going to see. It could be anybody.
What would you say to people viewing this show? They've never really heard of DPC except they saw it in passing and they said, I've heard about this. I want to see what people who have it. What are the 2 or 3 things that you would say sold you on it?
You want to go first?
Yeah.
Okay.
Go ahead.
I would say cost savings, which were unexpected. I thought it was going to be more expensive. Less stress, better care. Those would probably be the top 3. I mean, the care that we get is above and beyond.
Yeah.
I never really thought medical professionals should be judged as, customer service kind of thing. Like, there's just too much. Nobody's going to be happy with the doctor that has to manipulate a broken bone. But if there was a customer service thing, Jack would have, all 5 stars. And he's a DO, so he probably can manipulate all your bones.
Right. And it's convenience. I mean, the convenience is hands down priceless. And he can spend the time and he's happy to be there.
Yeah.
He wants to be there. He wants to be your doctor. He's not answering to some CEO and how many gold stars did you get on your patient satisfaction scores, because we're all happy. He's happy.
Isn't that amazing? There's no metric to measure how many gold stars he gets, and he gets more.
Right.
It's nice having a happy doctor too.
It
Yeah.
sure is.
Yeah. He wants
Cheerful.
to be there, and he does.
Yeah. He is not burned out. He is not looking for the exit.
Right, because he has a limit number of patients, a finite number that he has in his practice. He's able to manage that. He does it amazingly. And Dr. Forbush is fantastic. And if everyone could have him as a doctor or someone that's similar to him, they would be so fortunate.
Yeah. I would say if there's DPC available in your area, talk to the practitioner and see if you can try it out, on a trial basis, maybe 3 months, maybe just a physical. I mean,
And just
it's
see the
amazing.
difference.
We were blown away after our first appointment.
It was really the first appointment.
It was. I came
Yeah.
home and went to his Facebook page and wrote a long, glowing review.
Yep.
And I will still, on my own Facebook page, trying to get the word out. Whenever I've got an appointment or something with the boys, Quinn or Elliot, that I need to get taken care of, especially if it's the kind of thing that I know other parents will be going nuts over and facing difficulties, I'll be like, yep, my kid needed an antibiotic today, and I didn't have to go and wait, and I didn't have to make a call, and I didn't have to drive anywhere. I just told the doctor who knows me that we see every time. I try and tell those stories because it's amazing. And if more people could try it and experience it, I think healthcare in America would fundamentally change.
Autumn and John Zarowski, thank you so much for joining me.
Our pleasure. Thank you very much
Thank you
for
so
having
much.
us.
And you've done a great job in describing from your point of view as parents, patients, and DPC clients. Well done. And I hope more people take your advice to heart. Thanks so much.
So,
Yes.
thank you.
Thank you so much.
This is Hunter Schultz for Winning Healthcare Food Fights. Stay healthy, wash your hands a lot, and there you are.